Welcome to Healing Your Life with Oriental Medicine with Anita Brown. It's a place where you'll hear about the alternative healing methods to improve your mind, body, and emotional well-being.
Welcome. We are so glad that you're here. I'm Suzanne Lynn with Anita Brown, of course. This is her show. She lets me come in and talk a little bit about Oriental medicine and healing and herbs and acupuncture. And Anita, welcome.
Thank you, Suzanne. I'm glad to be here.
Anita, I think that there's some confusion, maybe a little bit of gray area for a lot of us who aren't familiar with acupuncture, have heard positive things about it, who believe that there's healing in herbal medicine, but we don't really know what it is that you do. Can you explain more about that?
Suzanne, what I do is I facilitate healing in individuals due to appropriately diagnosing them and giving them the treatments that they require to allow the body to heal itself.
Okay.
Everybody's an individual, so everybody needs something a little bit different.
That's a really good point. And you have said that a lot of your clients have chronic pain, and that's what probably your biggest client base is on.
Yes, it is. I have a lot of individuals with chronic pain, and if they can't get help via prescription medications or physical therapy or whatever else they've tried, I'm usually the last resort, the last on the list. And surprisingly, I have a lot of naysayers that come in and actually get help. So it gives me a lot of job security in a way.
Yes. That is so interesting because I think one of the goals we'd like to do is have people think about you as not the last resort, but as a first resort, so that you're not getting filled up with pills and going through surgery that's maybe, I don't want to say unnecessary, but maybe there's a more natural alternative to that.
Oh, absolutely. It's the key from my perspective is that a lot of times in the Western society, they haven't been taught about acupuncture and what it can do. It's just that we have to kind of educate people as to what acupuncture can help them with and get them to be comfortable with acupuncture.
No pun intended, right?
Yeah, no pun intended.
The thing that's funny is that my sister went through chemotherapy and she found acupuncture to be really relieving, and it not just relieved her stress, but she felt like it was releasing her of toxins, and her pain was really minimalized. And that's the first that I started thinking and believing in this stuff. I think we all know somebody that it's helped.
Yes, I get a lot of referrals from people that say that, I was referred to by so-and-so who said it changed their life. Not only physically with elimination of pain, but just they felt better emotionally and other things, and their health changed as well. So a lot of improvements made throughout their body.
One of the most surprising things to me was the vast array of physical ailments that you can bring relief from. Can you talk into some of those?
Oh, yes. I help people with migraines, allergies, digestive issues. We do a lot of treatments with, of course, musculoskeletal pain. A lot of people have depression and sleep issues, which are resolved with acupuncture and herbal medicine.
Very interesting. Do they normally go hand in hand, acupuncture and herbal medicine?
Yeah, I call acupuncture is one of those things I can only do on individuals when they come to my office. Herbal medicine is the take-home therapy.
So if you're not able to, if you can't get out there social distancing, you're still able to help them.
Correct. Yes, I can still diagnose them. I can diagnose, based on, I do a lot of pulse diagnosis, which is hands-on. I'd have to be touching the individual, but I do a lot of facial diagnosis, tongue diagnosis, and that fills in the gaps with their symptomology and their complaints. So I can kind of get a good idea of what will help as far as herbal medicine.
So we talked about the physical ailments, and you touched on depression. What other emotional things that people are experiencing can you help with?
Oh, stress and anxiety is the next.
Mm,
That is huge. And stress and anxiety, as you know, and as we know in Western medicine, perpetuates a lot of other health issues, heart
yes.
attacks, high blood pressure, high blood sugar, high cholesterol, and so on and so forth. So stress
Wow.
relief, anxiety relief is one of those things that can change a person's health status just
Hmm.
by some simple treatments.
Can you talk to the needles? Talk about that, as far as the pain, because they're probably so very small that you don't feel them, but that's one of the mental blocks that I would have to get over.
Right. The needles, they're fine. They're actually finer than a human hair.
Oh,
Uh, so and
wow.
the average hypodermic needle can hold 10 acupuncture needles.
No kidding.
Yes.
Well, that can't hurt that bad. I
No, it
mean,
doesn't.
that's
And
yeah.
they're solid. So they're very sharp. They go into the skin. Usually people don't even feel it. It might be a little prick, like not even like pricking yourself with a thistle or something. It's very minute. And
Okay.
the feeling afterwards, people say they feel energy flow throughout the body, or they feel that sudden rush or sudden release of energy where they can just relax, where it kind of takes out all that stress that's bottled up, and it's a release point.
Is that the endorphins that it's releasing?
It's the
Yeah.
endorphins, because it directly affects the brain chemicals. So it releases those endorphins, those feel good hormones.
Very
So it's a
interesting.
good fix. A lot of people
Yeah.
come in, they say, "Oh, I need my acupuncture fix because I'm, just stressed out beyond relief."
Wow. That's unbelievable. And to think that I mean, depression and all these things, you're not a doctor technically, but you have just about as much education as a doctor.
Right. Yes, I've gone through with everything about 8 years of education.
Wow.
We do
Wow.
extensive education in herbology and along with the acupuncture, plus in medical prescription drugs and medical Western medical diagnosis. So we know all the diseases and how they're diagnosed and treated in Western medicine. So we have an idea of how the person is maybe responding to their treatments. So I can look at them and say, okay, well, this is being done and it's not working. So we're going to kind of hit that from another angle. But
Hmm.
everybody's treated differently in Chinese medicine. It's not like Western medicine where if a person has rheumatoid arthritis, they're treated with some kind of drug that helps with rheumatoid arthritis. We see it as a whole different pattern diagnosis where we're treating the person as a whole and not the individual symptomology.
Well, we are going to dive into this through the podcast and video casts that we're doing. This is just the overall general, foundational show for people to understand what it is that you do. Now I want to move from acupuncture into herbal medicine. So let's take a quick break. We'll be right back and we'll move into that herbal side of what you do. Okay, Anita?
Okay, great. Thank you.
Thanks.
Anita Brown Acupuncture and Herbal Medicine is all about healing your mind, body, and emotional well-being with traditional Chinese medicine, or TCM. From chronic and acute pain to arthritis, IBS, digestive health, inflammation-related autoimmune conditions, insomnia, colitis, depression and neuropathy, and even infertility, TCM can treat a variety of symptoms and more. And the hundreds of herbs Anita is educated in not only treat symptoms, but boost nutrition in the body. If you're tired of being in pain and feel like you've tried everything, this is the time to call Anita Brown Acupuncture and Herbal Medicine and find out more about the healing ways of acupuncture and herbal medicine. Easy telehealth options are even available. Call Anita today at 352-231-2000.
And we're moving into the herbal side of what Anita does. And Anita, I'm so excited because when it comes to the herbals, I think that we are so in the dark as Americans and with Western medicine. And if there's something that can naturally treat us, why would we want to pour pills and go through surgery and do all that extreme medical stuff? You shouldn't be the last resort. We should consider you a first resort.
Absolutely, Suzanne. Herbals should be considered one of the first resorts with medicine if you're trying to improve your health or if you have some complaints. Let's take high blood pressure, for instance. There are so many herbal therapies that are great for blood pressure, but you have to take into consideration too individuals why their blood pressure is high, and that's where I treat uniquely with herbs. Herbs can actually quell the symptoms and reduce any chances of side effects. They help reduce the blood pressure naturally, depending on what the person, their causative factors are for high blood pressure. So, and with that, it goes across the board with any ailments. Chinese herbal medicine can be modified to treat the individual. So there are no side effects. We're treating directly the causative factors, and we're not leaving the person susceptible to other ailments or other chronic illnesses due to medications.
What you just said, that there's no side effects, absolutely blows my mind, because it wasn't too long ago I was speaking with a physician and they said every single medication has at least one side effect, and it can go up into double digits from there. Each dose has at least some side effect.
Right. The synergistics.
You know,
yes.
yeah.
Between, and then you get drugs. If you mix three prescription meds together, you don't know the side effects. They compound and multiply, which they can't even figure out. So, and a lot of times, some of my treatments, I have to go back through an individual's prescription meds that they're taking, because a lot of the side effects that they may be experiencing are due to the medications, and it's hard for me as a practitioner to get a handle on symptoms related to drugs. So I try to wean people off them with, them going back to their physician and saying, okay, I'm going to try this, let's monitor my symptoms more closely here and see if we can eliminate some of these prescription medications.
A lot of us have had experience with, okay, well, I'll take a little ginger, I'll have a little ginger ale, my stomach's upset, or I'll try a little bit of, thyme because this has that effect, or this takes my headache away, or this melatonin helps me sleep. Why would we not listen to our bodies and realize that those small examples you can treat on big massive ways?
You're absolutely right. I mean, why don't we see that? Because when I'm talking herbal medicine, we're talking about complicated formulations. So I might mix upwards to 20 herbs in a formula to help combat symptoms in an individual, or help, boost their energy levels or get rid of migraine headaches. So they're very orchestrated formulas. We put a lot into making the formulation safe so they don't have any negative side effects. And what a negative side effect might be stomach upset, or something to that nature. Nothing that's going to be severe and long term, but we don't want any negative effects from our herbal formulas.
So when people walk in, for example, I have a very strong history of breast cancer in our family, on both sides of our family, several close deaths. So that would be something that you would sit down, you would go through the family history and go, okay, what's in your DNA? Right, exactly.
Yes, and that's why I would prescribe formulas to say, okay, and I hate to use the word imbalance, but throughout the body, there are systems in place, and whether you're upregulating or downregulating certain chemicals or hormones, I can tell through the pulse which systems are unbalanced, I guess you would say.
Wow.
To put it simply. And
so
then
literally our pulse?
Yes. So I sit with a person's wrists and feel their pulse, and I'm not feeling for the rate. I'm feeling for qualities within the pulse. So there are probably, I would say, upwards to 75 different qualities that I'm looking for. And each quality is associated with some kind of disharmony within the body.
That
So we go
is
through systems,
incredible.
organ systems, heart, liver, lungs, kidneys, spleen, you know, the brain, everything can be felt via the pulse. And then
Hmm.
those pulse positions, say the lungs, if they're feeling choppy or some other quality that's a hard quality that's not normal, then we'd say, okay, well, we need to treat this because this is the predominant dysfunction in the body.
Wow.
So it's
Anita,
pretty interesting. It's you can pinpoint. I don't sometimes I don't
incredible.
like people to tell me what's going on before they come and see me, you know,
Oh,
or what their
wow.
diagnosis was. I really want to feel it, and then I'll start asking questions.
No kidding.
So
You know,
it's pretty interesting.
something has gone wrong in America. Something in the last 40, 50 years. I don't know if it's the hormones or the processed foods, but we're bigger, we're more unhealthy, we're getting cancer at higher rates, we have worse health than we ever have in the history of, I don't know, maybe the world. I don't know, but you know, oh, could you fix that for me?
Right. I know it's not that we lack medicine. Our
Right.
medicine, we have a lot of Western medicine out there. And then it's not that we lack the ability to access medicine. I know they like to say that with poor communities. It's because they're unhealthy because they lack access to medicine. And I don't think that's the case. I think a lot of times in those poor communities, they are being treated, but they're being treated, overtreated. With medications and maybe not educated enough, but as far as what health is, because it has a lot to do with diet and our environment and our mental state, stress. I mean, we know that all these things combined are can make or break your health.
Absolutely. How many times have you heard about someone going through a tragic, they've lost someone they love, and then all of a sudden they get physically ill? It's all connected.
Yes, it's all connected. I see that so often. I see a lot more people that have emotional traumas and then manifest illness than I do that have illness without emotional trauma.
Wow.
So, especially chronic pain, that emotional trauma goes hand in hand with chronic pain, whether it's the loss of a spouse, a child, some traumatic event in their life.
Wow. Wow. There's so much more to get into, but I'd love to wrap up this first foundational show with you telling us a success story. Can you share something from someone who was really, you know, in a lot of pain and went through some treatments with you with acupuncture and or herbs and came out on the other side?
Oh, yes, I can. I can tell you about an individual, an older patient, chronic pain. She was diagnosed with a lot of rheumatoid arthritis, osteoarthritis, as well as fibromyalgia. She came into my office with a walker, using a walker. I swear it took her 5 minutes to walk 50 feet to my office. I treated her. We went through a full treatment. We talked a lot about her state and her illness and all her emotional trauma. And then I treated her with acupuncture. And she got up and walked out. One thing I did notice, she left her walker behind. So it was pretty interesting. She came in with pain so bad that she could barely walk. And then through talking and the treatment, she just relieved her so that she just got up off the table and walked away.
If you could say to someone who's in pain and they've been thinking about acupuncture and herbs, but they're a little bit nervous, what would you say to them?
I would say it's going to be the most relaxing treatment you've ever had. And emotionally, you will feel so much more free and you will feel empowered, like you're taking your life back after a treatment. There's just something about it where you feel like I've done something good for myself. And you know how you get that person that's positive in your life that kind of pushes you forward? That's what acupuncture does.
Thank you for joining us for this episode of Healing Your Life with Oriental Medicine with Anita Brown. Please feel free to call her with questions that you may have at 352-231-2000 or visit her website at www.anitabrownAcupuncture.com. We're thrilled to be able to share stories and insight as to how alternative Chinese medicine may help improve your life and decrease chronic physical and emotional pain. And please be sure to subscribe to this channel so you don't miss a single episode. Individual results may vary, and our advice is not a substitute for medical advice from a physician. Please consult a physician before making any changes or adding to what has already been put in place for you.